Uh, Welcome everybody from DocSpot audience. We are here to talk about pain management, and we've been in talks with Julia, who is the founder of Galen Myotherapy. First, I'll try to introduce myself. I'm Saujanya. I am a student of BARC's diploma. I'm studying canine behavior and ethology, and I'm a pet parent to two dogs, Sammy and Zoe. And I think they are the ones who brought me into this whole new field of dogs, I think. And yeah, so I got in touch with my mentor, Sindoor, because I was trying to figure out some issues and things like that with my dogs. And I was so intrigued about the whole canine behavior, and she was teaching. So it's been about a year into my course. And through this, I got to know about Julia as well. So I have had distant support for my dog, Zoe. She's a beagle, and I think that has helped us a lot, and I'm very happy that Julia has started something called distant support, which we will get into through the whole live session at some point. um, uh, Julia, would you want to take over and talk a little bit about yourself and how you got
Yeah.
into all of this? Yeah.
Okay,
Yeah.
definitely. Well, hello
Yeah.
everyone, and can I first of all thank DogSpot so much for inviting me on. It's such an honor to be asked to talk on such a platform. So thank you for the opportunity. We have so many friends in India. It's lovely to have the opportunity to hopefully connect with all or some of you. So first of all, thank you. Yeah, I started Galen Myotherapy quite a long time ago now. It's nearly 20 years, which is a bit scary. So
Wow.
I started it in, 2002 was when I actually started. But the beginnings actually started about a decade before that. And if we've got time, I can tell you about my dog that inspired me to start. So,
Yes,
yeah,
we will. Yeah, we will get into
I,
it. Yeah.
I will mention him. I will mention him. So yeah, so I started it back in 2002, and when I started in the UK, there were, I mean, I didn't know anyone else that was working on dogs in the same way, and there was very, very little therapy. There was very little hydrotherapy. There was very little any other type of therapy, acupuncture, anything. So I was a little bit on my own out there, starting up, but it, Galen myotherapy and myotherapy is so results driven. The results were just so amazing for some of these dogs that I got my
Okay.
hands
Yeah.
on and managed to treat. That it sort of grew and grew and grew. So I started off visiting dogs, and then I got my own little place in the garden to treat, and then I got an office, and now I have a whole training establishment, which is lovely because it's been organic growth and it's grown through success of the dogs. It's the dogs that have grown this really, because it
Yeah.
does really work incredibly well
Okay.
on chronic muscle cases. Yeah, so that's a bit of
Yeah.
my story.
Uh, yeah. On an average, I think, how many dogs do you think you have worked on? I think in this long duration that you've been practicing?
Well, I worked it out once, and it's about 4,000. At one
4,000.
time,
Wow.
one time I was working on 9 dogs every day, and that
Okay.
soon develops. Yes. Um, and that's a really important thing to actually highlight is that all the training and all the information and everything that I'm going to talk to you about today has come from the dogs. So it's
Correct.
learning from the dogs and their reactions to the treatment and their behaviors before, during, and after the treatment. So it's
Correct.
very authentic information,
Yeah.
I'd like to think, anyway.
Yeah.
That, but with a massive backdrop and deep foundation of understanding of anatomy and physiology, because
Correct. Yeah.
you cannot work on a dog's health without having a really, really good knowledge of those
Correct.
subjects.
Correct. Yeah, I
Yes.
absolutely agree. Yeah. Yeah. So let's just say hi to whoever is online at the moment.
Okay.
And yeah, I see quite a few of our BARC students here. So hi,
Oh,
everybody.
hello. Hello.
Yeah. Yeah. I
I've
think they
met
were
I've
all
met a
looking
few.
for. Yeah. Oh, yeah. That session was quite informative. I think that was my first one-on-one, like with you, and I think that was so intriguing. And I think around that time I was doing a little bit about overloading and what we'll get into a little bit later. But
Yeah,
then quite informative actually that session, and to be able to observe our dogs a little more than
yeah,
what we just see them and actually really observe them. I think that was quite interesting. So I think we have a few people online here, and quite a few people are saying hi to you. So hi to everybody, and I think we will start off with the session. So I actually really want you to start off with basic or what is myotherapy, because when I heard this was a very new term. I had no idea what this is. I think Sindur mentioned it to me when I brought my dogs in for with to her, and I was quite blown away about what this is. And the only thing I could tell my people or explain it to people is that it's massage for dogs basically. But
yeah.
I want you to get into actually what myotherapy is and what is Galen myotherapy. I want you to
Okay.
start off with that. Yeah.
Of course, love to. So myotherapy in the strict translation means muscle therapy because myo is Latin for muscle. So it's muscle therapy. So what conditions we work on are chronic pain, chronic muscle conditions, and as I said, we'll go into that a little bit more later. But it's a very specialized area. So we work with specific cases of chronic muscle problem, not acute. That's not so
Okay.
much our remit. So acute means after they've had a massive accident, straight after traumatic surgery or anything like that. We
Correct.
work in the ongoing after the acute has settled down, but then they could go into a chronic pain scenario from, as you mentioned, compensation and loading problems. So
Correct.
myotherapy is muscle therapy. So you're absolutely right. It's hands-on therapy. So we use massage techniques.
Okay.
And but it's not just that. Galen
Yeah.
myotherapy is really a lot more about the observations as you've already pertained to. So it's assessing a dog before and during and after the treatment. So
Correct.
we have different guiding principles that are we're very proud of, and they're very much part of how we work. So the first one is our choice-led treatment, and I know we
Correct.
are going to talk about that a little bit more in detail, but just to give people an idea, choice-led treatment is, as it said, it's a dog's choice. But
Okay.
choice-led treatment in different remits, if you like, of the dog's life mean different
Yeah.
things. So we're working with dogs that are actually hurting. And we
Correct.
might touch an area where they might not be aware that they're actually perceiving pain. So we've got to work with them in a very, very specific way. And so the choice is quite extraordinary because even though the dog is suffering discomfort and maybe a little
Correct.
bit touch averse sometimes, by giving them their agency, their autonomy, their choice, they actually can give their own opinion on the treatment and
Treatment.
select the treatment. And it sounds a bit airy fairy, as we would call it. Can't think of a better word, but actually, it's all scientifically substantiated. It's
Correct.
very, very interesting. And so
Correct.
the choice led treatment is, I could go off on one, as you've realized. So, choice led treatment's one. The other one that we really, really love to incorporate within our whole treatment, from, as I said, before we even meet the dog, right the way through to post treatment, is we call it owner empowerment. So
Correct.
you call it pet parent, dog parent. We say
Correct.
owner. I can't bear the name owner, quite frankly. But anyway, that's what we call it. That's what we
Yeah.
call people, I should say, that have dogs. So we like to give people who have their dogs knowledge, information, and practical skills of how they can actually help their own dogs as well.
Correct.
So
Correct.
if we are treating one-to-one, then we show people, but we also have a distance support program, which again,
Correct.
you mentioned, which is we can actually support people from a distance and help them
Correct.
treat their own dogs. And
Correct.
that is something that I love, because if it's your dog, you want to be able to help them.
Correct.
Not everyone does, but most people do. But also by helping them, you begin to learn more about them and you get to know them more, and your bond deepens. And then if you have another
Correct.
dog or other dogs, you see more. And it's a wonderful way of growth of knowledge.
Yeah,
So,
this I absolutely agree with, because
right.
I think, yeah, as I mentioned, I did distance support, and then and I have been learning this a little bit, not exactly myotherapy, but about dogs.
Yeah.
And the feedback I got and the report I got, I mean, there were such minute details that
Yeah.
I missed, and I was like, okay, I mean, we need to look at even this, like,
Yeah.
it's quite insightful, I feel. And I think we do need a professional's guidance into all of this. But yeah, I really am very happy that you started this, and you are providing it to a lot of dog parents who can help their
Yeah.
dogs as well, which is what is
Absolutely.
I think the goal, right, for all of us, that we are able to help the
Exactly.
dogs here. Exactly.
I'll
Yeah.
tell you actually,
Yeah, I think we lost Julia a little bit over there. But does anybody have any questions on myotherapy in general? We will be taking up questions for Julia. Um, Hi Mohit, I think you mentioned about your dog who's limping.
came up to me
Yeah, I
and
think we have
spoke.
Julia back. Yeah.
Yeah. Did
Hi.
I go,
Yeah.
or was I still there?
Yes.
I
No,
look
you
like I've
you were off.
frozen.
Yeah. Yeah.
Okay,
You were
okay.
frozen. Yeah.
All right, I'll come back. If anyone heard anything, then I'll repeat it.
Yeah.
Big moments. I'm sure people know that you remember the moment you were, where you were, and the time it happened. And
Correct.
I just talked at a seminar there, and I had people coming up talking to me, and someone talked about their dog, and they were in tears. They just didn't know what to do. This dog was obviously in massive amount of pain and discomfort,
Yeah.
and I felt powerless, totally powerless. And I feel quite emotional even thinking about that, because she needed help. I know that I could have helped this dog, but we had no mechanism for doing that. So on the
Correct.
way home, on the flight home, it was a long flight. I had a lot of thinking time. I thought, we've got to put something together. So this was how the distance support program was born. So we can
Correct.
now help people to help their own dogs all over the world, which is really exciting.
Yeah, yeah. There was another thing that I wanted you to talk about, which is how did you
Mm.
get into myotherapy? I do need to know your
Oh,
story,
oh,
because yes, I don't
ah,
know your story. Yeah. And I
what?
know that all of us have a story, because I think we do have one dog or a couple of dogs who get us into this line of work. And I think we
Yeah.
all have a story, and we do have a dog to thank for that. So I want you to tell me what your story was into getting into all this field.
Well, I mean, every good story starts with a dog, doesn't it, really?
Yeah,
So
definitely.
this was in the mid 90s, and I had funnily enough, I got a puppy Labrador now, and she's not quite 6 months, but I had one then called Huffo, and he was a yellow lab. Not that that's got anything to do with anything, but he was just a puppy. One day he actually just couldn't lift his nose from the ground, and I had left him with friends for the weekend, so I didn't know what had led to that. But all I know is that because he couldn't lift his head up, he could walk, but he couldn't lift his head, then he was really struggling. And so if the dog can't move like that, they can lie down, but they can't get up. They can sit down, but they can't get up. So they're really, really compromised. So I went to the vet. I traveled many paths. And of course, this was the mid 90s, and we didn't have the diagnostics then. And
Correct.
basically, story short, I was told that I had to have him put to sleep, because there was
Okay.
nothing anyone
Still.
could do, and nothing showed up. And it was just a 6-month-old puppy. No,
Yeah.
no, no, no. But we were beginning to think that that was going to be the case, until I met another vet. He was actually a large animal vet, and
Okay.
because we have large and small animal vets. And I said, what is wrong with my puppy, please? And he just looked and went, hurt his neck then. I went, oh, it's something as simple as that. Right? Of course.
Correct.
He hasn't got a degenerative, whatever Labradors might or might not have. He had
Correct.
hurt his neck. So luckily, his appetite was still good. And I started to encourage him to just do some small functional exercises with a biscuit. And he
Correct.
started to lift his nose. And then he went on to live until he was 17 years old. So
Wow.
I know he would have been put to sleep at 6 months. At that point was when my nightmare started of all the other dogs that were suffering because the drugs generally are not that effective, especially long term on chronic muscle pain.
Correct.
Being put to sleep. I mean, I get bad back, I get a bad neck, but I, to put it bluntly, don't want to die because of it. Yes, it's painful, but this was what was happening. So he was my inspiration. So I knew that that was going to be my path.
Correct.
Yeah.
See, I was waiting for the story and it would make sense to hear it from you. So yeah, I think this is a beautiful story. Yeah. Yeah.
I am
Okay.
sure that so many people that are listening have got the same stories or similar stories
Absolutely.
that have drawn them down a path. And that is
Correct.
really great. Yeah.
Correct. Yeah. So there is just one question from one of the viewers, which talks about even if the dog is fine, would you advise muscle therapy or giving any kind of massage? What would you say about this, Julia?
Well, in my experience, it's a bit like people, really. Very few people are completely symmetrical. Very few dogs are completely symmetrical. And it's more of a preventative than a curative. I would much prefer to look at a dog that was potentially fine, pick up things that may be just slight tweaks, slight imbalances, manage to correct those, maybe assess the environment, assess activities and things, see if there's anything that might be exacerbating that and correct or change that. So we prefer prevention rather than cure. So I think that that would be a really great thing to do.
Correct. Yeah. So I
It's
hope,
a good
Rahul, your
question.
question. Yeah, yeah. So I hope your question is answered, and we will get to all of these pointers, I think, a little later in the session now. But we will move on to our next topic. So I did come across two basic terms in the when I was studying this part, which was compensation and overloading. Could you actually give us a little bit about what these two mean really, and yeah, a little more about them and how to observe them and things like that?
Okay. I think the easiest way of understanding this is to relate it to ourselves. So with compensation, it basically is our body is designed to move. It's an innate thing that we need to be able to move for survival or whatever else. So it will work out a way of moving and transporting us forwards. And that's exactly the same for dogs. So if we have, say, for instance, a bad knee or a bad hip, we are going to try and guard that area or avoid that area and shift it. So we will then develop a bit of a limp or a bit of a tilt in our walk. And when that happens, the muscle development and the muscle use changes in our body. We have a very defined chain of events that within our muscular system or our myofascial system, which enables us to walk at different gaits. So that will shift. So that's a compensation when things shift. So they are compensating by moving the load. Now, the moment you start talking about load and shifting the load, that's when you can then bring in overloading. So over a long-term period, and it could be weeks, months, or often years, the body has had to adapt completely and overload on an area. And then quite often, we see that is the area that becomes apparent first to a lameness. So often we see an area that is overloaded as being the effect, not the cause. So you may take your dog to the vet for a front left lameness, but actually it could easily have come from the back or the right hip or somewhere else in between. So that's the difference. The loading then becomes overloaded, and it could just take your dog tripping over something,
Correct.
and the lameness can suddenly start from apparently nowhere. And
Correct.
often
Oh
people
yeah.
say to me, they were fine yesterday and they're hopping lame today. Well, they actually weren't fine, but you didn't see anything that was particularly
Yeah.
wrong with them.
Yeah. This is exactly what happened with my dog, for whom I took distance
Ah,
support, where she started limping on her right forelimb, and I was like, why did she start this all of a sudden? But I did know that she was having some overloading issues, but then this limping started all of a sudden, right? So I think, yeah, this is quite insightful, and now I understand why we work on chronic pain more than
yeah,
acute, because I think over time that overloading and compensation actually becomes a problem for dogs, right? I
huge,
think, yeah,
huge.
yeah,
I mean,
yeah. Okay,
I've treated many dogs that have underlying osteoarthritis, and
correct.
arthritis is a secondary condition. Generally, it is quantified as a secondary condition. So the
Okay,
primary would be probably an injury, but that could then result in muscle change, muscle shortening, because when muscles are injured, the only way they can really heal is that they actually shorten. So then that puts load on that joint, and that can pull that joint
correct.
closer together. So
Okay,
an arthritic pain is awful, but quite often we see that even though they've got that arthritic pain, if you ease off the compensation and loading issues, they're much happier, which is
okay.
quite
So I didn't know
interesting.
this about arthritis, yeah, because my older dog has arthritis, for whom I will
Mm.
soon be reaching out to you. But I didn't know that this is what is the cause of arthritis actually. But that's quite interesting.
Can be.
Correct.
It's a
Can,
very
yeah,
common, very,
common.
it can be, as I said, we call it secondary, it's a secondary condition. There
Correct.
are other
Yeah,
arthritises that are different, but osteoarthritis generally is secondary,
correct.
yeah.
Okay, okay. What are the conditions that you normally tend to see? Like, what are the more frequent conditions that you tend to see in terms of compensatory issues and chronic illnesses that are there?
Well, obviously, the osteoarthritis is a big one. We see a lot of dogs that have various repetitive strains. So it could have come out of nowhere or apparently
Correct,
nowhere. And then when you
correct,
track it back, and it's again something else we're going to be talking about, when you look at activity or weight or
oh,
the environment of the home
correct,
is massively important. We're
correct,
looking at lots and lots of assaults on the body, really, that
correct, correct,
then at first they can cope, but then it builds up and
correct,
builds up. So that's probably one of the most common things. It's
correct,
the repetitiveness of an activity or an environment that can lead to
correct.
secondary things. I mean, obviously, we
Yeah,
look at a lot of uh, um, conformational problems like hip
correct.
dysplasia or elbow problems or knee problems or things like that too. So
Yeah,
our remit is quite large, actually, even
yeah.
though what we're looking at is quite small, if you see what I mean.
Correct. Yeah, yeah. Okay, so we have discussed what causes this, but could you get into what are the signs? Like, how can a dog parent like me, or anybody who's watching this, how can they recognize that their dog is probably facing some form of discomfort or some form of pain?
Yeah,
How do they recognize
yeah.
this?
There are, once you know, there are so many, and I will try and just tell you a few of those. Now, we
Correct.
are going to talk about behavior because you cannot possibly talk about discomfort or pain without talking about a change in behavior. But we
Correct.
will
Yeah.
talk about that. Whether you want to talk about that now or a bit later, then we can do that. But there are other things to look at, and
Correct.
posture. I've sort of talked about posture a little bit because if a dog goes into a compensatory pattern or an adaptive change, their posture will change. And
Correct.
I was just saying before we came online, all my shoulders look crooked, which
Oh,
I
crooked.
am.
Yeah.
I am definitely asymmetric. I have to work
Correct.
on my muscular system all the time. So my posture changes, and it changes when my neck hurts, it changes when my back hurts, as all of ours does, whether it is just temporary or a permanent change. So a dog's
Correct.
posture and their superficial anatomy. So that sounds really grand, but basically all I'm saying is their shape. Their whole
Correct.
shape changes. So many dogs become
Correct.
very loaded in their shoulders and neck and very
Correct.
thin around their back end. So what we generally say is if you can find, if you're lucky enough to have had your dog from when they were younger or a puppy, find an old picture of them and have a look at
Okay.
that picture compared to what they look like now. And that's a good indication of whether their posture has changed.
Changed.
So
Correct.
that's a good way of having a look, because if they are guarding something, they will change how
Yeah.
they look. So that's one thing. As I said, posture's the other, but look at their feet. Everything shows through their feet because that's where they have to share the load of their whole body. So their feet should
Correct.
be nice, tight toes, and they should all be pointing forwards, and they should be
Forwards. Okay.
square with each other. Now, quite often we find
Okay.
that dogs' feet turn out laterally. I'm wrong screen now. This foot. It turns out
Yeah.
laterally, so they turn out
Yeah.
sideways. The
Yeah.
toes could start spreading, all sorts of things to try and equalize the load as much as they can. So feet
Okay.
are a massive way of seeing. And the other one is the
Okay.
top and the tail. So the head position
Okay.
and the tail position.
Okay.
That takes a little bit more experience, but if you have your old photo, you can see whether
Yeah.
the head is still high and the tail is still at a good position.
Okay.
So that's just
Okay.
a few things. One more, which I think is key, is their
Yeah.
coat, the condition of their
Okay.
coat.
Okay.
Now, we all
Okay.
try and feed our dogs well, and so they should
Yeah.
be nice and shiny. But if they've got a
Yeah.
dull patch, which quite often is
Okay.
over the back or their hips, that can
Yeah.
mean that there is a real blockage and a real overload, or just a lack of good superficial or peripheral circulation to that part of the skin. And that
Okay. Okay.
then will show itself in a dead coat,
Cool.
a sort of
Yeah.
a dry coat, and
Correct.
also the
Yeah.
coat direction will change too. So there are quite a few
Okay.
things that you can actually look at.
Yeah. Now that you mentioned that, I did see a little bit of coat difference in my dog, golden retriever, on his hips. So I think they were becoming like lumpish, and I think something of that sort. And I
Yeah,
do know that he has hip dysplasia and arthritis. So I'm guessing that
yeah,
that's one of the things that we can observe. Absolutely.
exactly.
Yeah.
It is like
Yeah.
putting pieces of a puzzle together. It really is.
Correct. Yeah, absolutely. Yeah, yeah. And the other thing is, it never is the place that where we observe it to be happening, right? You never
No,
know where it is coming from, and that's why I think dog-led treatment is quite the important way to
exactly,
go about it. Yeah, it's all
exactly.
coming together now. Yeah, yeah,
Yeah,
absolutely.
exactly. And
Yeah,
going back to that, I think an important point is because it is choice led or dog led, our treatment, we work over the compensatory issues first. And then what that can do is it then basically starts to unwind the dog from their scrunched up self. So it starts
correct,
to unwind. And by
correct,
doing that correctly, you then start to ease the load over the primary cause. Because
correct,
what upsets me is unless you know what you're really doing, people find it very clever, and it's not, to find areas of pain in a dog by basically poking them, going, oh, well, that hurts. Well, yeah,
correct.
that's not difficult. The difficult
Yeah,
bit is to unwind that. And that's
correct,
what enables us to do that because it is choice led.
correct. Yeah, yeah,
Yeah.
absolutely. Okay, so we did speak about signs, and I think once the parents have recognized the signs, I think now we would want to help our dogs, because once we know that there are signs of discomfort, that's obviously our next step.
Yeah.
So, how would you suggest that once we have recognized a few of these pointers, how would you suggest that we help them?
There are quite a few ways that you can do that. I talked very briefly earlier about our environment. I think
Correct,
one of the most potentially um, serious thing that we have in our environment, can't think of a better word, is our flooring. Our
correct,
flooring can be so slippery. And I know that if you look over YouTube, there are people showing videos of dogs sliding and puppies sliding all over the place, thinking it's hilarious, whereas actually it is really destructive to their bodies. If you think about it, if you lived on an ice rink, on ice skates, you would be really uncomfortable and you would fall over a lot. And that's sort of what our dogs are having to do. They have slippery pads, and when they're put on a very slippery floor, they haven't got any traction. Their feet are meant for soil, something that they can have traction. So it's a bit sad, really, because a lot of us put flooring in so we can clean the floors, so we can keep our dogs and look after the house and keep it all looking nice. But actually, it's the worst thing for the dog. So the thing to do really is to try and get some mats down, some non-slip mats. Your floor will still look gorgeous, but the lovely thing is you'll know that your dogs can have a trail that they can walk around. It's so important. Abduction injuries, and abduction means when the legs go out sideways, are so serious, and they can completely lose all their stability within their whole skeleton. And it has a big effect on them, a very big, serious effect, both front legs and back legs. But of course, if you're looking at a puppy, that can be, that type of damage can get really serious. So that's one thing, is look at the environment. The other thing is your activity. Dogs have got amazing noses. And one of the best activities you can do for them is allow them to sniff and allow them to explore their environment. We are, when I say we, all of us are quite obsessed with this word exercise. We've got to exercise our dogs. Exercise doesn't have to be physical. And actually, often we over-exercise physically our dogs, and that can be one of the biggest problems. So look at your activity, look at the repetitiveness of it. If your dogs are chasing a ball or a frisbee, really review that. That is not a good thing to do. Dogs are built to run and jump, but if they're doing it time and time and time again, repeatedly, they will become injured and it will become a big problem. So we look at things like that. So look at your activity and your environment. That's a really big thing. If you can just assess that, that's fantastic. And then to really counter that, one thing that is so great, if you think your dog does have a problem, is you want to do something for their neck. In every dog, this I've found over all the years, and it's never changed. So this is pretty much a rule that if a dog is got any form of lameness or discomfort, it will reflect through the neck. So their neck will automatically shorten. And this is the main highway to the body for everything, for absolutely every system. So the neck we need to be aware of. So one of the really easy ways is to actually get them sniffing so their heads are down, because when we're exercising them, we're always keeping their heads up, which then has an impact on their back. And you can do treat searches. So you can feed them with a treat search, and that can work really well. And I do that inside or outside. So you don't need to have an outside space to do it.
Correct.
So, so I hope that's a little bit helpful of signs to look for, and perhaps something that you can do.
Correct. Yeah, immediately after. And you mentioned about flooring, right? But what about furnitures? Because we do have a lot of furnitures and, jumping off and getting onto the furnitures and things like that. What would you suggest people who have like for example, I do have a very high bedding, and and my dogs do sleep on my bed. So I think that also could be something that must be deterring their condition, because they're constantly jumping off and jumping onto the bed, I'm guessing.
Yeah, it's anything that is repetitive. I mean, as I said, dogs are built to jump up and jump off, but not as much as they do in our environment. And if you, I think the big thing is to consider that dogs have been, we've known dogs for thousands of years, and their anatomy hasn't changed, not at all. However, in the last 50 or so years, their environment has, because they now live in houses with us. They haven't adapted at all. And we have
Correct.
got to be aware that we have to offer them as close to the environment that they are built for. So you're absolutely right. Furniture, bedding, it's something we've got to be aware of. I mean,
Correct.
being realistic, our dogs live with us on our furniture. So you either have to have some sort of step location so they
Correct.
can go up and down steps or ramps, or you lift them on or off, or you
Correct.
restrict certain access at some times of the day. It's really
Correct.
up to the individual. I think one thing that I am very, very hot on is if a dog is used to being with you, one of the most stressful things is to remove that from them. So we
Correct.
have to
Yeah.
work a way around it rather than just excluding them from something. If
Correct.
we've included
Absolutely.
them, then we have to work out a way of continuing to include them because we're lucky they
Correct.
want our company, quite frankly.
Correct. Yeah, absolutely. And I have observed this in my dog that when the days when he's probably in more discomfort, he doesn't really jump onto the bed as much because, and then
Yeah,
he does have bedding on the floor. So he chooses that. And the days when he feels a little better, he does choose to come on the bed. And I
yeah,
think that also reflects a lot about how they are able to choose what is good for them and what is not, I think, in this situation.
definitely,
But
definitely.
there is one thing that I do want to talk about is that when you talk about fetch, right? And that's what you were mentioning, that chasing the ball and chasing the
Fetch. Yeah,
frisbee, and yeah, a
yeah.
lot of people do say that my dog loves chasing the ball and my dog looks fine. How would you talk about this? Because that is something that we do hear and then we do see that, right? What do you have to talk about that?
Well, I think anyone that says that is fair enough because their dogs do give us the wrong stories sometimes. A, they are not good at telling us that they're in discomfort. And B, they're telling us they love it because they do, but it's more like a chemical thing. It's just tapping in to part of their brain that they just can't switch off. But
Correct.
they don't realize that they're actually hurting because they are so pumped that they
Correct.
can continue running and jumping and twisting and turning. If you want to see what it's doing to your dog, look at it in slow mo. You have a look,
Oh,
anyone looks at one time that they land, twist, and turn. Look at the body and what it's doing. Look at the load on the
okay.
shoulders, and the shoulders are only attached by muscle. There's no
Okay. Yeah.
support of bone, and the neck is connected to the shoulders. And if you damage the neck, you damage your dog. Absolutely.
Correct.
So
Correct.
it really is, it's about repetitiveness. Now, what I suggest, it's very difficult. You actually do have to sort of wean them off. It's like a
Correct.
compulsion. So what I
Correct.
suggest you do is why don't you get them to find it? Don't throw it, get put it somewhere and get them to find the ball. So they are sniffing. They're now
Sniffing.
going into a whole different mechanism. They're moving
Yep.
slowly. Their necks are down. So they're extending their neck and body. And they're really
Correct.
using their brain and their problem solving. And that too
Correct.
is very calming for them. So it's good for them
Correct.
physically and psychologically. And then when they come home, they'll be much calmer because a lot of these
Correct.
dogs, after having that type of exercise, even though they're uncomfortable, can end up being hyperactive. So
Okay.
you think, oh
Yeah.
well, actually they want more, or they still need more stuff that actually they can't switch off.
Correct.
So
Yeah.
it's
Yeah.
it's it's a complete opposite what they're showing to actually what's going on. But
Correct. Yeah.
slow
And
mo
as
it,
yeah.
slow
Yeah.
mo it.
Yeah.
It
And
will be terrifying.
yeah. And as a behaviorist, also, I think we have learned that sniffing is actually very good for calming the dogs down and getting the stress
Yeah,
off their life. So I think that's quite the I think biggest takeaway that I think the dog parents can have here. That I think move to sniffing and move to treat searches, and I think that should help.
more sniffing.
Uh, yeah. Sindur has a very good question here about you're talking about neck, right? Because that's a very important part of the body for the dog.
Yeah.
How about collars? Because we do see a lot of dogs on collars when they're being walked. So, what do you think collars have an effect on the neck?
Absolutely. Before I go on to that, can I just say,
Yeah,
generally, whatever is good for the dog's brain is good for the dog's body. And that's why good dog trainers, good behaviorists, and people that work on the physicality, we're talking about the same thing, which
same thing.
I find wonderful. That's why
Yeah,
Sindra and I have got on so well, because we're talking about the same thing. Yeah,
yeah,
collars versus harnesses. Okay, first of all, I'm going to say it's not the equipment, it's how it's used. So a collar goes around the neck. I think this is,
correct,
we still do it because there's some form of tradition around
correct,
putting a collar on a neck.
correct.
So if a dog is just wearing a collar and there's no force to it, then that is not, I mean, I would wear a collar. I could wear a collar, no problem. The moment though, that gets attached to something else, there is a potential there for huge amounts of damage. So
Yeah,
if you consider your neck, if you just do that or that, press in here,
yeah,
it's
yeah.
really uncomfortable. So if you put
It's
something
quite,
tight around
yeah,
your neck, it's horrible.
yeah,
Now, just because our dogs are not going, you're strangling me, they actually are. It's the same. The anatomy is the same. You've got main blood supply here. You've got the main neurological system has to come from here to your whole body. So potentially a collar and lead, you can inflict a lot of damage, and often you're not aware you're doing it. You've got bases of hormone delivery and all sorts of things
correct.
around the neck. And
Yeah,
also, a neck can become incredibly painful if they are
yeah,
suffering from any other compensation. So the collar is, it's, there is a lot of opportunity to actually hurt and injure your dog through
correct,
putting a collar on. However,
correct.
a harness a harness is much better option as long as it's well fitted and it
Correct.
allows your dog movement. The harnesses that go across the front of the shoulders can be really restrictive to the dog
Correct. Yeah. Yeah.
because it stops that movement and they need
Movement
free
here. Yeah.
movement.
Correct.
Likewise, with these good harnesses that attach here and probably go around the neck, make sure
Yeah.
that when you take up some of the strain, it actually hits the pointy bit here, the sternum
Okay.
of your dog, and it doesn't dig into there. Because
Okay.
that could then, if you pull, that could dig into that part of the neck. That's if you push here, it's uncomfortable, but it's perfectly bearable. If you push here,
Yeah.
you're being throttled. So a
Correct.
well-fitting harness to allow the legs not digging into the neck, that is the best thing. And then I know people will say, well, actually, I can't hold my dog on a harness. Well, that is up to training. And we've got to work with our dogs to do it. We've got to work with them to prolong their health and to give them the opportunity of longevity. And that
Correct.
means just going to good trainers like yourselves that will actually show us how we can allow our dogs to walk safely on a lead
Correct.
and harness.
Correct. Yeah. Yeah. Absolutely. And I think there was another question about hardness, doing a shoulder dislocation and everything. But I think you did mention that, the right fitted harness is what we are looking for, right?
Yeah,
Leash on the neck
absolutely.
collar. Yeah.
And of
So
course, the
I
ones
hope.
that go around here, again, it's not the equipment, it's how it's used. That's what we
Correct.
always say. It's not the equipment, it's how it's used, and the
Correct.
potential for it being misused.
Correct. Yeah. Okay. So we will move on to our next topic, which I think you have
Okay.
covered a little bit, but we will address this separately, which is lifestyle. What are the lifestyle contributors? Because I do know that you mentioned about home, like, the environment where, the flooring that you mentioned.
Yep.
But what are the other lifestyle contributors? We did also talk about activities, high energy activities.
Yeah,
But yeah,
absolutely. But I suppose one that we can talk about, and it's not my, it is a very important subject, but it slightly goes out of my remit, and that's about weight, the correct
Okay.
weight of a dog. So we're talking about load, as in a
Correct.
shift of load because of injury. If a dog is
Correct.
carrying too much weight, that dog will be carrying too much load anyway to begin with. And
Yeah.
if then they've got a shift of load too, with too much weight,
Yeah.
it's just going to make any condition so much worse. It
Correct.
almost is, it's like the magic formula to get your dog to a good weight.
Correct.
Because if they are carrying too much, A, their body has to work more, but they are just physically carrying more.
Correct.
What we often do is pick up a kilo of rice or something and put it in a backpack and ask someone to carry it. They go, well, that's a kilo. That's
Yeah.
just a kilo. Your dog is 5 kilos overweight and they're a Labrador or whatever. That is a
Correct.
lot of burden that they're taking. So really, keeping your dog as trim as possible is the best
Correct.
way, again, for
Correct.
longevity.
Correct. So when we are talking about weight here, I think a lot of people do over exercise their dogs in terms of physical exercise. Um,
Yep.
how do you think that's going to damage them? Maybe. I think we lost Julia a little bit there, but I hope you all your questions are being answered. I hope you're getting answers for whatever you were part of this discussion for. And Sahitya and Gargi, I think your questions got answered in terms of what we need the home environment to be. And any more questions that probably you can ask, and I'll see if I can. Niyati, I think you could get in touch with a canine nutritionist for this, because they'll be able to help you with what diet you can actually give your dog. Um, you need to work with a few professionals when you're talking about these kind of things. I think for your purpose, I think a canine nutritionist would be the best person. And then I think we have Julia back, I'm
Oh,
guessing.
I ran the wrong way. Why has that happened then?
You're back, but I do see you in a very,
I know.
how
Why?
could you, yeah,
No,
maybe turn
that's
your, yeah,
how strange. It was exactly the same position as it was. There we go. Don't you just
yeah,
love
yeah,
technology? Just completely
yes,
blanked out. Sorry about that, everyone. I didn't mean to go.
no, yeah,
We were
yeah,
talking about, I think we were talking about perhaps exercise for dogs that were perhaps a bit overweight. Was that right?
correct, yeah, exercise, over exercise, any physical exercise actually, like in terms of helping the dog to lose weight.
Okay, I think sometimes people can be a bit misled into thinking that if a dog is overweight, or even, as I was pertaining to earlier, exercise-wise, dogs don't need a lot of exercise. They need stimulation, which is a balance between mental and physical. So we've talked about the scenting already, but especially if your dog is overweight, the last thing they really do need is a lot of high impact exercise. So really not running, really not a
Correct,
lot of trotting. We like to see
correct,
dogs walk, and walk is a 4-time gait. So each leg moves separately, not a diagonal, that's a trot or a pace.
correct,
So walk is really powerful for any form of rehab, and
okay,
any form of weight control too, because walk is a great gait. If you are trying to ask a dog that's overweight to do a lot of running, whether it
yeah,
is encouraged, or I have seen lots of dogs go out with bikes or on with other type of devices, and they,
Correct.
or even out jogging, they have no
Yeah.
choice. They have no choice. And if they want to
Yeah.
stop, they can't really stop. So
Yeah.
it's not great for them. It's a high impact sport. High impact is not something on a prolonged, repetitive level that not built for that
Correct.
break.
Correct. Yeah. Yeah. Okay. I think we again lost her. Uh, Julia, are you still there with us? Okay. I do see a couple of questions here in terms of X-rays every year, but I think,
Sure.
yeah, I can hear you, Julia, but then I think your video is frozen. In the meantime, I'll just respond to these questions and I'll also take it to Julia after she's back. Yeah. So X-rays, I think Julia will talk about something called comfort scale. I think that would be a better thing to monitor your dogs on. And I will get her to talk about the comfort scale also. And I think I'm going to show up what Sindoor has put up here in terms of, yeah. So Sindoor is doing a study on street dogs, and she is talking about how they're not very engaging in a lot of frenzied activity. They move deliberately and efficiently and for limited durations. So I think she is talking about how street dogs in their natural environment are very slow in and very deliberate in their movements, I think. Yeah, Julia,
Yeah.
yeah, you're back.
I'm sorry, you would think that I live in the back of beyond. I live in a really populated area, and yet the internet is appalling. Sorry,
No, no, that's
everyone.
okay. Yeah, yeah. I was just taking a few questions here in terms of,
Uh-huh.
so people are asking about X-rays, whether they need to monitor the X-rays every year or 6 months or something, and blood reports or something. But I think you had a comfort scale that you wanted to share with all of us. Would you want to talk
Yeah,
about that?
absolutely. X-rays, I'm not really, that's beyond my remit really. But all I know is that's quite invasive really, because the dog will generally have to be sedated or anesthetized. Whereas what you can really do to check on muscle health is just use your hands and observation. So this is something that we have put together, let me put it around the right way, is our Galen comfort scale. Now, we keep on
Okay.
talking a little bit about behavior, but this is actually split into four sections. So we've got the physicality of the dog that we're looking at, the behavior, eating and digestion, that's another sign that could indicate
Yeah.
that there might be a problem, and also other indicators. So there's a lot of behavioral issues that we are looking at. Now, some of them aren't on this comfort scale, but this can give you an all-round understanding as to maybe what's going on with your dog, and you can actually assess it, whether they do whatever we're asking all the time, sometimes or never. So you can
Okay.
actually get a percentage of comfort for your dog. So this is
Okay.
great because it gives you an idea of what's going on with your own dog, but also
Correct.
we use it to present to vets for a before treatment and after treatment, but also for
Correct.
individuals that they can assess the change in their
Correct.
dogs. But
Correct.
behavior is massive. And I think before time has gone on so quickly, hasn't it? Before
Yeah.
we
Yeah.
leave, that yes, I've just seen, is it for download? It will be. If we don't get it to you today, we will get it to you soon so you can
Yeah.
download a PDF. So you can have a
Correct.
look. And on the back, it's a bit of an explanation about what everything
Correct.
means and what you're looking out for. But
Correct. Yeah.
behavior is massive. And I think
Yeah.
the one, if there's something that I really want to say is you try and get some form of empathy with your dog. And when I say empathy, think about how you would feel if you were uncomfortable. So one of the easiest things perhaps to consider is a lot of people can get headaches. I get a
Correct.
lot of headaches. How do you feel when you are you want to avoid
Your voice is breaking, Julia, but I think, yeah,
still there or not?
I Your voice is like very robotic, I think, at the moment. But yeah, I think Julia has moved to our next topic, which is the pain and behavior connect. So I will just talk about my experience about pain and behavior because I have been learning, canine behavior and ethology. So how I got into this was my dog, who is Sammy, who is a golden retriever, and I think when I went to Sindoor as a client, it was because my dog started growling at me when I was. Going closer to him, and then I got a younger dog, which is Zoe, and he was really not okay with her. He was constantly fighting with her, and I couldn't understand what was happening really, because he's a golden retriever and we all have hi Julia.
I'm not featuring on the screen now, but
Yeah, I can
I'm
see you.
so sorry. This is very frustrating for me
No,
to
that's okay.
and for everyone I know, but my internet.
Yeah,
Anyway,
yeah.
I can't remember where we
I
were
was
now. Where
actually
were
talking
we?
about I was talking about Sammy and his behavior change actually, and then we can talk
Mm,
about the behavior because I was just filling in for them that how I
thank
saw
you.
behavior changes.
Yeah,
Yeah. So Sammy started growling at us, and he stopped
yeah.
being very friendly with us. He started being very
Mm,
aloof from us and my other dog Zoe, and that kind of threw me off because he was a very friendly dog up until then, right? Like
yeah.
interacting with other dogs, interacting with other people. And when I went to Sindoor for the first consult as a client, she told me that probably he has pain in his hips. Have you checked it? So that was kind of an eye opener for me. And the funny thing is, I think in his x rays, it never showed up till the last year. That is about 3 years after Sindoor mentioned that there could be some pain for him. So I think another reason why I wouldn't really completely trust the x rays is because probably it may not show up in the x rays till,
Good.
it has
Yeah.
progressed quite a bit, right?
Yeah, yeah.
Yeah,
No,
yeah,
X-rays obviously don't show muscle.
correct.
So often dogs are X-rayed to find out what is wrong, and it shows nothing. But
Correct.
exactly, exactly. So muscles, as I said, really, it's your hands and observation. So if you think how you feel might be with a stomach ache or a headache, you might get a little bit grumpy. You might not want
Correct.
to talk. You might not want to interact with people. It's exactly the same as dogs. So we
Correct.
have got to be try and be empathetic and think, well, how would I be if I wasn't feeling that well? Also, if someone else came running up to me, if my back hurt, I would probably get quite vocal before they arrived. Don't go anywhere near me.
Correct. Yeah.
But so it's about trying to relate how we might feel to how dogs feel because it would be the same. The other thing is
Correct.
they project and communicate discomfort and pain in some very different ways too. I mean, for instance, one that can be very common is a licking of their feet, because that could
Yeah.
be like a pins and needles, and that can be often a neck problem. And it can
Okay.
just be one foot, it can be one paw, it can be one nail even. Also, they can
Okay.
start biting or biting at parts of their body. So that
Correct.
those are other behavioral changes that we
Correct.
see. But there
Correct.
are so many. But I think really, before it suddenly drops out again, it's really about thinking how you would feel if you were in
Correct.
any form of discomfort. And I always think that, I always, if someone says to me, oh, after your treatment, my dog got really quite naughty, you go, yes, because if they're being naughty, that means that they are feeling well enough to think about different things that they can do, not
Yeah.
just the very, very basic,
Base.
straightforward things. They're thinking of extra things, which means they're feeling better.
Correct.
And it's things like they stop playing. They should be playing. Dogs generally are quite playful, especially if they
Correct.
always have been. And the other thing I just want to say is if people have a dog that's about 8, please don't listen to anyone if they say, well, your dog's getting old, because 8 is not old. It probably means they're just slowing down or a little bit uncomfortable. I would say
Correct.
17. Yeah, okay. They probably are a little bit older now.
Yeah.
I had a 15-year-old Newfoundland. I've had 17-year-old dogs. mobility is such a big contributor to longevity, but
Exactly.
also health span, not just lifespan. So
Correct.
please don't think that your dogs are getting old when they reach the very young age of 8.
Yeah, yeah, absolutely. That's a good insight, I think. And finally, the last part. Would you want to talk about when are you visiting India again? I missed the last time you were here, but I
Yeah,
am really looking forward to when you will be coming to India.
I am so excited. We came over to meet up with Sindor and her wonderful team, and we met some amazing people back in May 2017. I have such
Yeah,
happy memories from that trip. And we are coming back, and I'm looking down to make sure I get the dates right. I'm coming back on
dates.
February the 4th to the 7th next year, obviously dependent on COVID, but we're just going to
COVID.
move ahead with that plan.
Yes,
And
yes.
I know that Cinder and I are going to be talking about different things that she would like me to do and different seminars and different trainings. If anyone has
Correct,
anything specific that they would like, please let us know. So we're going
correct,
to cram as much in as possible to that visit, and
correct,
I'm so excited to actually
correct.
to say that
Absolutely.
I'm coming over. So yeah,
Yeah, yeah. Yeah, and the other thing is that since you're coming here, would you want people to finish their foundation course in Galen before they have workshops with you? Because I know that you do have a foundation, online foundation course.
yeah, yeah, we do.
Yeah,
The best thing to do at the moment is to look on our .co.uk site or to look for
correct,
the foundation course on the Bark site, and you can do the
correct,
foundation course, and actually that will answer a lot of your questions with regards collars, harnesses, activity, furniture,
correct,
all of that. It will show you and demonstrate to you what can happen. And we look a
correct.
lot at posture. So the foundation course is great. So you can start with downloading the comfort.
Yeah, I am posting Julia's website and Facebook and IG handles.
Back or I
And I,
do.
yeah, I can hear you, Julia, but I think you're frozen. In the meantime, I would want to update everybody that you could
I
go on to
can't
Bach's
hear.
website. Yeah, yeah, I can hear you now. Can you? Okay, in the meantime, Bach's actually has
Again,
a code for the
internet
followers
dropped.
there. You can go and then follow Bach's and you can sign up for the foundation course as well as the distance support that we have been talking
You can hear
about.
me.
Yeah, I think she will join back in for the last bit of it. But yeah, you can always check the Bach's website, and they do have the Galen Myotherapy as an affiliate there. And yeah, I think she's back on. And I have posted Julia's website. Yeah, they were asking
Thank
for your
you.
website details. I was just posting them.
Tracy, I'm so sorry. So, yeah, there are various things that we can help with. First of all,
Yeah,
it would be you can have a look at the download here. We'll get that up and we'll make sure that everyone knows where they can get that.
yeah,
There's also, if you want any help, we've got our distant support program, of course,
correct.
that you can see on our
Yeah,
website or on the Barks website too, which is
yeah,
obviously
yeah,
closer to home. Along with that is
yeah,
our foundation course, which we're very proud of, and that you can access, and that is a pure online completion course. But we
yeah.
do have
Okay.
some, we do have some other news, don't we? Really?
Yeah,
The duration is about 5 to 6 hours. What
yeah,
about that for an
yeah.
instant
Okay, five to
answer
six
there?
hours.
Yeah.
Yeah, it's all online, right? They can access the
All
whole course.
online. All
Yeah, yeah,
online. Yeah.
yeah. I would recommend everybody to actually who are interested to do the workshop with Julia in Feb that you do the foundation course so that we
Yep.
can get into the more tougher ones in when she's here. I would really do recommend that.
Yep.
Yes, we do have an announcement. would you? Yeah, please
We
go
do
ahead, share
have an announcement. I just hope the internet stays long enough for it.
it.
Well,
Yes,
this is something, I mean, Sindor and I have known each other now for 5 years, and we've been in constant contact. And ever since we first met, there was such a synergy between us and such a connection. And we've been working together for a while. And as I said, I came over to India. But the big thing that we really wanted to do was bring myotherapy to India, because we know that there are
correct,
so many of you that really desperately want to help your dogs and actually train with a high level of training, because this is like the
correct.
Barks course, it's a very high level of training. And so
Okay,
on the 1st of September, drum roll, we are actually launching Galen Myotherapy India. So
okay,
if
yes,
anyone's interested on finding out more, go to the Barks website, contact us through the .co.uk website.
yeah,
But then on the
yeah,
1st of September, we'll have everything up so you can see all the information
okay,
you need to know if anyone's interested. So we're so
okay, yeah,
excited. We are so
yes,
excited.
absolutely. Yes, absolutely. And I think if anybody has any more questions, I think they can drop it here, and then we'll see if we can answer later on, and then get to them probably, right? I did
Definitely.
try to probably answer most of the questions here, and
Oh, thank you.
yeah, and I hope everybody enjoyed the session. Julia, how was the session for you? Cool.
I loved it. The thing is, anyone that knows me knows that I can just talk and talk and talk. So I can't believe we've been talking for an hour. I have loved it.
Yeah.
Thank you.
Yes,
You're
same here.
brilliant. You asked some great questions.
Thank
Thank
you,
you.
thank you so much, Julia, and thank you everybody. And do
Yeah,
be tuned in on the Galen page and the Barks page for all the information, so that
yeah,
you are updated about what is the latest news about the Galen and Barks affiliation,
lovely.
right?
And
Yeah,
Dogspot, thank you. I think you're
yeah,
amazing. What a
yeah,
wonderful forum to people to find out
absolutely.
so many different things. So thank you again for inviting me.
Yeah, yeah. Thank you so much, Docsport, and thank you, Julia, for your time.
Thank you so much for your great
Yeah, yeah,
interviewing skills. I look forward to
yeah.
meeting you in February properly.
Absolutely, yes. This time I'm not going to miss meeting you.
No, I'm not going to miss you.
Yeah.
Lovely. Thank
Yeah.
you very
Yeah.
much,
Thank you so
everyone.
much.
Goodbye,
Yeah. Thank
everyone.
you,
Thank
everybody.
you. Bye bye.
Goodbye. Yeah. Bye.